Hi, I'm Aruna Subramanian, and I'm Chief of the Immunocompromised Host Infectious Disease Program at Stanford. Today I'd like to tell you about our wonderful team. This program is also known as Transplant ID in some centers. We have 9 faculty members who are dedicated to this area. Each one brings a unique perspective. One has antimicrobial stewardship experience, another has lung transplant infection experience, some have bone marrow transplant as their area of interest. We have others with travel medicine or tuberculosis and transplant. Each one of us brings a very unique perspective to this area. We have 2 consult services. One is a heme BMT service, where we see patients who have had allo or auto transplants. We're a very big bone marrow transplant program. We have haplo transplants, cord blood transplants, CAR T therapy. We have lots of patients with heme malignancies or those with chemotherapy-related infections. And our second consult service sees solid organ transplant patients. So those with heart, lung, liver, kidney, pancreas, or intestinal transplants. All of these patients have very unique infections and very unique risk factors for infections that the fellows learn about. As first and second year fellows, you can round on these services, be part of weekly meetings and discussions about cases and protocols, and learn what's unique to this area of ID. Fellows with a very special interest in immunocompromised ID can apply for a dedicated 3rd year fellowship. This is a year of intense training where people are embedded into the primary transplant teams. They're involved in creating and updating protocols and algorithms related to prophylaxis, diagnostics, and treatments in transplant patients. We have outpatient clinics dedicated to immunocompromised host ID that fellows can be part of. And they can, of course, be involved in a variety of interesting clinical research projects. We have fellows working on breakthrough nocardia infections in patients who aren't on trimethoprim sulfa, screening for TB in cancer patients, invasive fungal infections in AML patients, just to name a few studies that were recent. We see the most interesting patients and cases in the hospital. So I hope you'll come to Stanford and check out our wonderful immunocompromised host ID program.